Staff have been called to return to work in some hotspot areas as the country's number of COVID-19 cases continues to rise rapidly. Hospitals are already feeling the pressure as the infection rate surpasses that of the first wave.
In September, the first COVID-19 wave came to an end as the number of daily infections dropped steadily. The country slowly began reopening in full gear for the festive season. But as restrictions eased, infections spread, and in mid-December, the president announced that the country was officially experiencing its second wave of the virus. For frontline workers, there was little reprieve, as once again they were inundated with patients.
There are huge pressures in terms of both staff and space to accommodate patients, and in these situations there are some very difficult calls to make about who should receive oxygen, ventilators, etc. In other areas, some of the private facilities in areas that are less overloaded, obviously things aren't quite as bad. But because of the time of the year and reduced staff numbers, I think the pressures are greater, and this is exacerbated by the fact that the spike is higher than it was and the peak greater than it was during the first wave.
With the festive season upon us as well, hospitals are already burdened, and trauma units add to the pressure.
We've been experiencing a high number of patients, especially with trauma cases, your gunshots and your step chest. We also experience a high influx of patients coming with difficulties of breathing.
We have seen, obviously, numbers rise with a lot of motorists on the road, motor vehicle accidents and general trauma-based incidents. This is obviously compounded by the pandemic.
Screening of patients is also an additional burden on the system.
The screening process is a burden on its own. We are short-staffed, and it's always been a cry that particularly healthcare workers, nurses and doctors are very short-staffed. The personnel from Cuba are assisting a lot, but we still remain short-staffed.
There's great concern that this wave has seen even the young and healthy being hospitalized.
One of the differences we've noticed in this particular episode and spike of cases is the rapid rise in the numbers, and significantly the number of young people that are being seen in hospital facilities and even been admitted to hospitals. I'm aware of cases of 18-year-olds in ICU with COVID-related pneumonia.
With no end in sight, hospitals could find themselves under even more pressure than they were during the first spike. Hasina Gori, SABC News, Johannesburg.
Well, speculation is rife that South Africa could be looking down the barrel of a stricter lockdown. Yesterday, we breached the 1 million mark in terms of the total number of COVID-19 cases. The total number of deaths has now risen to close to 27,000. And the second wave has been much worse than expected earlier in the year, possibly due to a new variant or a mutation of the COVID-19 virus that has been found in South Africa. Let's look at the picture on the ground. We're joined by senior scientist at iThemba labs at Wits University. That's Professor Bruce Mellado. He's also a member of the Gauteng Premier COVID-19 Advisory Committee. Professor, thank you for being with us. Let's start with the overall picture. I mean, the second wave is turning out to be so deadly. I remember the predictions earlier this year that it could be quite muted. Discovery was saying 1 in 3 people already had the virus. There's a lot of immunity going around. What's happening now has happened very quickly. Is it all about the new variant and young people are now getting very sick as well?
Thanks for having me. So you've asked a number of questions, so let me try to address them one by one. So what we do at the province is essentially study the numbers very carefully. That includes active cases, recoveries, mortality, hospitalizations, mobility, and other different types of indexes that allow us to understand the situation and make projections. So indeed, one can say that without a reasonable doubt, we are in the middle of a second surge, and Gauteng is yet not past the peak. Obviously, we are basically going towards that. So the numbers actually can get quite large. Now, if you ask the question of how many cases do we expect to see during this second surge, taking into account all these studies and the calibration of the models to the data and trying to accommodate the models to the data, if there is no change in social behavior, if social behavior remains as it is right now, we're probably looking at the peak of the second surge to be about twice as large as the first one, which basically automatically implies that the healthcare system would be overwhelmed, our healthcare workers would be overwhelmed. So it is absolutely essential that a sudden and swift change in social behavior take place in order to avoid the size of that second surge.
That is incredible. So twice as large, the second wave compared to the first wave in Gauteng specifically. Is that in terms of infections and deaths? What about both those areas?
Right. That's a good question. So the numbers I gave you so that we can make a comparison with the first is in terms of active cases at any given time. And that would be active cases at the peak of the second surge compared to the first. Now, in regards to severe cases, hospitalizations, ICUs, high care and mortality, what we see right now is that the rate of mortality and ICUs and high care is similar to that of the first wave. So essentially, I mean, you can surmise from here that if we may have, again, should there be no change in social behavior, a peak which is twice as high, you're basically looking at double the numbers.
Sure. You've laid out the picture for Gauteng. I know that's your focus, but can you extrapolate that to the whole country? Are we looking at a second wave that is double as deadly, possibly, as the first?
Well, in principle, as I said earlier, as a member of the Gauteng Province Advisory Committee, our job is to scrutinize very thoroughly the numbers for the province. That's already a big job because there's a lot of sources of data and a lot of things going on. And not only that, we actually have to get information from the ground, from practitioners and doctors on the ground to ensure that our numbers and our modeling is realistic. So unfortunately, I can't comment on the rest of the country, but that is certainly something that the Central Department of Health can do.
No problem. So looking at Gauteng, if we look at the overall picture, how are hospitals coping right now? You said we're already seeing that surge, and many Gauteng, as we know, are in other provinces holidaying. So how does that change the picture when they come back?
Right. So we are monitoring the situation in hospitals and hospitalizations and different kinds of hospitalizations quite closely. So as of a couple of weeks ago, we've seen a significant increase in the number of all types of hospitalizations across the province. Indeed, this is consistent with the rise that we have. Now, obviously, the concern that we have right now is that Gauteng, while the numbers are relatively high, are still much smaller than the first wave, meaning that we are expecting significant increase in the next weeks. And one of our biggest and chief concerns revolves around the fact that we expect a significant number of people to travel back to Gauteng from other provinces that now are experiencing large numbers, and that will happen in a relatively small amount of time. And that will create additional pressure, and that will put our ability to control the pandemic in a very, very serious dire strait.
I think it was the acting premier who told us earlier that private hospitals are filling up. Are you able to give us sort of a picture, private versus public? And if you're in trouble right now in Gauteng, are you pretty likely to get a hospital admission? But of course, the worry is for coming weeks.
Right. So right now, the situation in the province, if you look at the numbers, we're still far away from that critical point. But the concern, of course, that may happen in weeks to come. And then you basically have a situation where different hospitals fill up, and then the entire system becomes heavily constrained. It's very difficult, of course, to predict how people are going to be moving around and what kind of hospitalizations are going to pervade with respect to others, geographically speaking. But we know that the numbers can grow very fast if there's no change in social behavior.
Yeah. Professor, you alluded to this earlier. In Gauteng, there's this incredible analytical tool, this visual platform, Wits, working in conjunction with IBM Research, providing government a way to sort of predict and see the models and predictions. I was looking at it, and it breaks Gauteng down by districts and sub-districts. If you look at Tshwane, for example, you zone in, and then you see that a lot of the new cases are in Atteridgeville, Laudium, and the Pretoria CBD. How is government able to use that sort of information?
Right, that's a very good question. So in partnership with the Department of Health and IBM, we've developed on the basis of artificial intelligence algorithms that allows us to group cases in order to effectively determine the location of hotspots and their severity, most importantly, their severity. Right now, we have about 100 hotspots that you can visualize, and everybody can visualize on the map. It's an interactive map. You can click on it. You can see the number of cases you have as a function of time. You can ascertain how severe the hotspot is, the number of cases, and also we have attached to it a level of severity with a number attached to it. So essentially what you see right now is that we have quite a number of hotspots in Johannesburg, A, B, D, and F. Sorry, E and F, excuse me. We also have, as of last week, quite a number of new hotspots appearing in Tshwane 3, which is what you're referring to. That includes Pretoria CBD. And also in recent days, we've experienced quite an increase in Ekurhuleni North. So you can see that basically the virus is spreading, and as a result of that, the creation of hotspots is certainly spreading across the geography of the province.
Professor, final quick question. The President to address us tonight at 8 o'clock. Any thoughts on what he should be doing from a medical perspective?
Well, our job has been so far is to provide the most advanced analytics in order to predict the evolution of the pandemic in the province. We have already communicated our findings to the Office of the Premier, who met with the President at 2 p.m. as far as I understand, and we're all looking forward to what the President is going to say later tonight.
All right, we appreciate your time tonight. That was Senior Scientist at iThemba Labs at Wits University, Professor Bruce Mellado. Well, the world is battling